Hello, I'm Dr. Drobez, and I'd like to present findings from a qualitative analysis of surgical experiences shared by individuals living with Parkinson's disease in the UK. Parkinson's disease affects over 150,000 people in the UK alone and is the second most common neurodegenerative disease with the fastest growing prevalence and disability as reported by the Global Burden of Disease Study 2015. Surgery is a high-risk period for patients with Parkinson's disease, and while much progress has been made in diagnosis and long-term management, the perioperative care remains inconsistent and often fails to meet these patient needs, especially post-discharge. To bridge this gap, our aim was to explore the lived experiences to center the patient voice in the creation of the first international clinical guidelines for the perioperative care of patients with Parkinson's disease. We recruited 4 patients from the Parkinson's UK patient network who had undergone surgery, ranging from deep brain stimulator insertion and hip replacements to emergency angioplasty. We conducted 2 individual interviews and 1 focus group involving 2 patients to explore their surgical experiences and used Loop Panel's research analysis tool to identify 4 dominant themes. First, medication autonomy was paramount. Patients repeatedly stressed that timely, self-managed administration of Parkinson's disease medications was essential to prevent freezing, rigidity, and distress. In settings where this autonomy was denied, outcomes deteriorated. Second, there were pervasive knowledge gaps among healthcare staff. Freezing episodes were often misunderstood or mishandled. In some cases, patients were forcibly moved or dismissed as uncooperative, leading to unnecessary trauma. Third, discharge planning was frequently inadequate. Many patients reported being discharged without a plan for physiotherapy, specialist follow-up, or community support. This led to regression, readmission, and in some cases, loss of independence. Fourth, strong empathetic communication is vital for a positive patient experience. This includes communication within multidisciplinary teams to aid delivery of high-quality care and also between clinicians, patients, and their advocates, facilitating shared decision-making and patient-centered management. Our conclusions are straightforward. Perioperative care for patients with Parkinson's disease must be tailored, informed, and continuous. Hospitals must support time-critical medication routines. Staff must be trained to understand the nuanced manifestations of Parkinson's disease, and discharge should not mark the end of care, but the start of a structured recovery. These patient-led insights are directly shaping the UK's first national and international guidelines. Our goal is to translate their experiences into safer, smarter, and more compassionate care. Thank you.